Obesity and the struggle to lose weight are two things that impact a lot of us, or probably someone you know.
That's for sure. Today we're joined by Dr. Jessica Gonzalez Hernandez from Secours Surgical Weight Loss to explain what options we have. Dr. Gonzalez, thank you so much for being here with us. We really appreciate you being here. We're talking in the break about the rise in interest in weight loss surgeries, but first of all, let's talk about who the candidates are for weight loss surgery.
Sure. So, any patient that has a body mass index over 40 or over 35 with one medical condition such as diabetes, high cholesterol, high blood pressure, or sleep apnea would be a good candidate for weight loss surgery.
And then explain exactly what you're getting when you do a weight loss surgery.
So, it depends. There's different types of weight loss surgery. So the two most common ones are the sleeve gastrectomy and the gastric bypass. On the sleeve gastrectomy, we remove 80 to 90% of the stomach and it's gone forever. So patients lose weight because they get restriction. They can't eat as much, they get full faster, and most of the hunger hormones that is produced in that part of the stomach that we remove. So these patients are typically not hungry for a couple months after surgery.
Oh, wow.
And then on the other side, on the gastric bypass, we also make a small stomach pouch. So there's the restriction portion where patients cannot eat much, but we also reroute the intestine. So patients have a component of malabsorption. They cannot absorb all the calories from the foods that they eat.
And a lot of people, seeing a lot of these weight loss shows, you just think that someone that's overweight is automatically a candidate for weight loss surgery, but you mentioned BMI. Explain what BMI is, because that's the ratio between your weight and how tall you are.
Yeah, so it's called the body mass index, and it's a calculation between your weight and your height squared. So usually when you go to see your primary care or your doctor, they usually will calculate that, and based on that is if you're considered overweight or obese.
So that conversation with your doctor is important to see where your BMI is, to see if you're a candidate, because just because you appear to be overweight doesn't mean that the weight loss surgery is the best option for you.
Yes, so again, it has to be over 35 if you have one medical problem, or over 40.
And then let's talk about the recovery process, because anytime you're like, cutting up your stomach and stuff, there's going to be a little bit of a downtime.
Yes, so recovery nowadays is much easier than it used to be. A lot of these surgeries are now done minimally invasive, so very small incisions, 4 to 5 incisions at the most. And at least my patients are up and walking the same day, and the majority of patients go home within 24 hours.
Oh, wow.
Most patients are back to their normal activities within 1 to 2 weeks. So recovery is not as it used to be.
And then
Technology.
when do you see, let's say, Jane goes in and does the surgery, you see Jane 2 weeks later, can you tell, or is it one of those kind of more gradual things because you're also not eating as much as you used to, because you can?
Yes, so usually, most of the weight loss happens within the first 3 to 6 months. So we are seeing big steps, as the patients come. They usually come see us about 2 weeks in, then 6 weeks, 3 months, 6 months, and a year. And most of the weight loss happens within the first 3 months. And then after that, after the 6 months, it starts slowing down. But yes, most of the weight happens early after the surgery. That's the difference between surgery and medication.
Yes, and if someone is watching, do they need to be referred to you, or can we just go ahead and get in touch with you right now?
Yes, they can call our office and they can do a self-referral. They don't have to be referred by their primary doctor.
And I'm sure you're seeing lots of lives being changed by things that they weren't previously able to do with their family, so I'm sure that keeps you motivated day in and day out. So
yes, it's very rewarding what I do, because I can, how their personal lives, their work lives, their marriage,
yes.
Their relationship with their kids, with themselves. It's a life-changing operation.
Awesome. Thank you so much. Bonsecours.com. Congratulations on your 7th anniversary with
Yes, happy
Bonsecours.
Annie.
Thank you.